Good afternoon, everyone. Today's topic is anxiolytic and hypnotic drugs. These drugs are used for the treatment of anxiety and insomnia. Anxiety can result in the stressful situations and the increased um, feelings of the guiltiness or the uh, in some tragic situations. And then insomnia can result from the disturbances of falling asleep because of the noise or because of the wrong partner. Then or can be result from waking up early from the noise, or also can result from the lack of the fast sleep or REM sleep. So all these conditions can be treated with the anxiolytic and hypnotic drugs. And most of these drugs are acting on the gamma aminobutyric acid receptors or GABA receptors or GABA neurons. So GABA neurons are inhibitory neurons, and GABA is activating the chlorine channels of this particular type of the GABA A subtype is a ion gated ion channel, and opening the channel leads to the entrance of the chlorine ions inside the cell that decreases the uh, potential of the membrane, and that leads to the hyperpolarization. And in this state, uh, it, it is harder to excitate the neuron, and that leads to the uh, decreased firing up of the neurons, and excitation will not develop. The GABA A uh, subtype of the uh, receptor is consists of the five subunits, and usually there are two alpha and two beta subunits, and the last one is either gamma or sigma subunit. So depending on the types of the subunits, there are different GABA receptors, A, B, C, D, etc. So, and in GABA A receptor, the alpha subunit may be alpha 1 subtype, and in that case, this receptor will lead to the sleep, uh, and if the receptor is or subunit is alpha 2 or 3, then that will be responsible for the stress and the anxiety. So depending on the type of the receptor. So the gamma amino butyric acid is released from the vesicles in the synaptic cleft to the synaptic cleft, and from the nerve ending to the synaptic cleft, and then that leads to the binding of the GABA with the active site that is actually here on the alpha between alpha and beta subunits, and that leads to the opening of the ion channel, and chloride ions will enter the um, postsynaptic cleft neuron, and then the membrane potential will drop substantially. That occurs in the amygdala, that is responsible for the most of our emotions, including the anxiety, angry, stress, and increased firing of this neuron will lead to the increased stress, for example, at work or during a meeting. So, and GABA neuron will release a GABA, and that leads to the decrease of the firing of the neuron, and that will decrease the anxiety and lead to the better sleep. There are there are three types of the groups of the drugs that affect the GABA neurons and GABA receptors. So the first group is benzodiazepines. The name of this group comes from the chemical structure because chemical structure is from benzene ring and diazo uh, diazo ring, so the fused ring. So these two rings are connected together, so and leads to the benzodiazepines. These benzodiazepines will connect with the receptor in the different site rather than the GABA itself. So these blue are sites of connection for the GABA aminobutyric acid, while the benzodiazepines will connect with the gamma subunit, and that increases affinity of the GABA to the GABA receptor, and because of that the uh, frequency of the opening of the GABA, this channel of the GABA receptor increases, so more chlorine will go through the channel, and that will lead to the calming down and also the inhibition of the neurons on the periphery as well. The drugs include alprazolam, diazepam, clonazepam, lorazepam, temazolone. These are mostly lorazepam and temazolone, mostly used for the sleeping agents, and chlordiazepoxide. Clonazepam commonly used for the uh, 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 for the treatment of the uh, other disease as well. So the side effects include the sleepiness during the day, the lightheadedness, and also the disturbances of the uh, motor movement disorders that can lead to falls. Um, so these are the main adverse effects. For next group, barbiturates are also opening the chlorine channel, GABA receptor chlorine channel, but instead of the increasing the duration, they increase. Sorry, instead of the increasing, yeah, the duration, they increase the frequency of opening of the chlorine channel, and that leads to the increase of the chlorine uh, entrance to the cell. One of the disadvantages of the barbiturate is a low therapeutic index because the toxic dose is very close to the therapeutic, and a light overdose can lead to the death because of the inhibition of the respiratory uh, center in the brain. That is why nowadays barbiturates are prohibited in most countries, including the Russian Federation. But the previously, like 10 years ago, some of them still were using as the drugs, and that includes phenobarbital, one of the most commonly used, also pentobarbital and secobarbital. Adverse effects include lightheadedness, sleepiness, the memory loss, and also death with a light overdose. And the third group is non-benzodiazepine hypnotics or non-benzodiazepine agonists of benzodiazepine receptors. That includes zolpidem, zalipone, and S-zopiclone, and also zopiclone. S-zopiclone is a long-acting version of zopiclone. So these receptors mostly interact with the alpha 1 subunit that is responsible for the sleeping, and that is why the adverse effects include um, the increase in the thinking abilities, the thinking abilities decrease, and answer duration increases, and the reaction time is increases as well. That is why contraindicated for those who are driving or working in extreme situations like construction workers, the pilots, and also the tightness and movement disorders. So these are the most common side effects of the non-benzodiazepine hypnotics. So these are used only for the sleeping disorders, and they usually have less sleepiness during the day, so that is why can be prescribed for people um, um, who require to work during the day much, uh, like without sleeping, adverse effects. So, but still there are some adverse effects still persist. So all these drugs have will decrease the quality of the sleep, and also abrupt withdrawal may lead to the rebound insomnia. So that is why the duration of treatment should not exceed 7 days, and withdrawals should be made uh, by decreasing the dose, uh, not abrupt withdrawal, uh, to prevent the rebound insomnia. So that's it for today, and thank you for your attention. See you next week.